All right, now to the latest on COVID-19. Massachusetts is currently in phase 2 of its vaccination distribution plan. So joining us right now are Bay State Health President and CEO, Dr. Mark Kerouac, and Mercy Medical Center's Chief Medical Officer, Dr. Robert Roos. I want to thank you both for coming on the program here. And I want to start with Dr. Kerouac here with my first question, because there's really been a lot of skepticism about this vaccine. And some people question whether they even want to get it. The COVID vaccine is not the same as what we get when we get the flu or maybe the shingles vaccine. Can you first explain for us here to our viewers at home how the COVID-19 vaccine works and why medical professionals say that they are sure that it is safe?
Well, the COVID vaccine is extremely effective and extremely safe, Don. It is a chemical that sort of fools the body into making one of the virus's proteins, and then that causes the body to form an antibody response, which then protects you against the real virus. It's been tested in between the tests for the two vaccines that are out now in over 70,000 people. And so the side effects have been tolerable: sore arm, a little bit of aches and pains in many cases. But we know that it's 95% protective against getting COVID-19, which can be a very serious illness in all age groups.
And right now there are two vaccines available to U.S. residents. We have Pfizer and Moderna's. What's the difference between the two of them, and is one considered, say, better than the other?
They really are identical in terms of their effectiveness, and they work in exactly the same way. They both are in the 94-95% range, which is a real home run when it comes to vaccines. And I think that the side effect profile as well is quite comparable. So I would urge people to get either one of them and not really try to prefer one over the other.
And Johnson & Johnson's vaccine is on the verge of emergency authorization. How is this vaccine different from Moderna's and Pfizer's? And what about the people who may be considered the one that's maybe less effective than the others for this?
Johnson & Johnson is a one-shot vaccine, which is an advantage, and it's also easier to store and distribute. Its overall effectiveness is in the 65 to 70% range for any sort of disease, but over 85% for serious disease, which still makes it a very effective vaccine. And, for example, better than most of the flu vaccines we have in any given year.
All right, I want to bring in now Mercy Medical Center's Chief Medical Officer, Dr. Robert Roos. We're currently in phase 2 of the state's vaccination distribution plan. Just yesterday, the state expanded the eligibility group to include people over 65 and those with certain health conditions. What are your thoughts on how the state has prioritized the distribution list?
Well, thank you. I believe that Massachusetts has taken a very thoughtful and methodical approach to increasing the categories of people that are eligible for vaccination. The categories that now are included in phase 2 follow the recommendations from the Centers for Disease Control and Prevention, and they really encourage those that are at the highest risk from complications due to COVID to be prioritized to get the vaccine first. So as now we move into increasing eligibility for those that are 65 and older, for people with certain medical conditions that put them at increased risk of complications, and elders that are living in public or private, low-income or affordable senior communities. I think it's been a very thoughtful approach to who should be prioritized. The question really is about managing the demand that is coming from that change with the existing supply of vaccines that the state currently has.
And we're definitely going to delve into that, but we understand there is a limited supply of doses at this point, so not everyone can actually get the vaccine right now. But do you think that the state is moving fast enough on all of this?
Well, the state can only move as fast as the supply that it has to be able to distribute and administer. You know, I think all of us are eager for this vaccination campaign across the country to move much more rapidly. We know that this is the pathway for us to emerge from a global pandemic that has wreaked incredible tragedy upon loved ones, families, communities, and the country. So we aren't moving fast enough, but I think we are escalating the infrastructure to be able to deliver vaccines, and we need to push, advocate, and escalate for more vaccine to be able to be moved out to the states and into people's arms as quickly as possible.
And we hear a lot about herd immunity. Can you explain what that means first, and then when you think that we'll actually reach that point?
So herd immunity is a concept whereby people get indirect prevention or protection from the transmission of an infectious disease by having a certain percentage of people in the population already immune, whether it's through vaccination or through natural immunity by having acquired the illness. When we're talking about COVID, the experts would continue to say that we likely need to have upwards of 70, 80, or 90% of people immune to the virus in order to reach the status of herd immunity, where the rate of transmission just continues to drop quickly. Here in the United States, that is going to be contingent upon us and how fast we can move this vaccine campaign. So in order to have 60, 70, 80, or 90% of the population fully vaccinated, having received 2 doses, and when that occurs is completely dependent upon how many vaccines we can administer each day. Some of the estimates have been, if we continue at the pace that we are on, about 1.5 million or 1.7 million doses given each day, we will only have about 50% of the population vaccinated by July, and it would take much longer to get to 90%. If we can escalate and get 2 or 3 million people vaccinated every single day across the country, we could reach herd immunity at some point over the summer. So it really is dependent upon and contingent upon a very quick, effective rollout of the vaccines that we have available across the entire country.
All right, Dr. Kerouac and Dr. Roos, thank you so much for joining us, and we're going to be joining you again throughout this program. If you have any questions for the doctors tonight, you can email us at reported@wwlp.com, or you can give us a call. We have this telephone number for you. It's open right now. It's 413-377-2222. Also on our panel tonight, we have Senator Eric Lesser and Mayor Dominic Sarno. We're going to be hearing from them next. You're watching a special edition of COVID-19 Vaccine Edition of 22 News at 5.